Hello, everybody. This is Gary. Today is Tuesday, February 28th, 2023. It is 5:53 p.m. Eastern Standard Time in the United States and Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, my anxiety levels are very high. I feel very nervous, somewhat paranoid and delusional, thinking people are following me, spying on me, plotting against me. Um, my auditory hallucinations are pretty intense right now. My depression is pretty severe. Um, I'm just trying to cope as best as I can. It's very cold and windy outside today. I did go outside today for my physical therapy and walking exercises. I just did some work on my computer. I'm about to do some meditation, which I've already done twice today. Um, Today is Tuesday. Day after tomorrow, I have an appointment with my psychotherapist. And on Friday, I have an appointment with my psychiatrist. Um, Friday after next, I have a endoscopy scheduled. That is to put a camera down my mouth and my throat to take a look at my esophagus and my stomach. The main reason for doing this is because I keep getting food lodged in my esophagus, and that's to the point where it cuts off my breathing, but lower down in the esophagus, I get food stuck, and they may have to dilate my esophagus so it's easier for me to swallow food. Um, I personally think this problem started when I started taking Seroquel about 15 years ago, and every once in a while they have to dilate my esophagus because Seroquel interferes with my ability to swallow food. Not to the point of choking or cutting off my breathing. It's always lower down in my esophagus that the food gets stuck. And then if I try to drink water, soda, milk, whatever, it just comes back up out of my mouth and nose because it has nowhere else to go because my esophagus has food lodged into it. Usually it goes down by itself in about 15 or 20 minutes. I did have to go to the hospital a couple weeks ago for this. They thought that I was going to have to see a GI doctor and have them force the food down during an endoscopy in the emergency room, but the food went down by itself while I was at the emergency room, so they didn't actually have to do anything. I did have a CT scan of my abdomen, and it shows that I have a hernia inside my esophagus. When I talked to the gastroenterologist yesterday on a telehome visit, and she says that's not the cause of the food getting lodged and that the hernia does not need to be corrected or dealt with. That's not the problem. It's a constriction in my esophagus that's going to need to be dilated, and they can do that during the endoscopy. Um, so what this entails is they will give me medication to relax my throat and my mouth. I'll be conscious but drugged. Probably won't remember most of the procedure because of the medications they give. And I will be sedated somewhat during the procedure. Um, on March 28th, I still have an appointment with the pulmonary specialist because I have pulmonary fibrosis and I need to know how severe it is. And pulmonary fibrosis is what scar tissue develops in the air sacs of the lungs. In my case, I'm not sure what caused it. My best guess is I was using too much Clorox to clean my apartment, and now when I go for walks or go up and down stairs, I get very easily out of breath because pulmonary fibrosis makes it more difficult for the lungs to exchange oxygen and carbon dioxide, making breathing more difficult. My primary care doctor noticed that I have ongoing rapid heartbeat and high blood pressure. So she gave me a third blood pressure medication um, to prevent pulmonary hypertension and an enlarged heart, which can be the result of pulmonary fibrosis. So, but that's all to report right now. The weather outside sucks. It's windy, it's cold, it's rainy, and not anything else to report. Like, comment, share, subscribe.